So I got a patient pregnant. True story. Well, I mean, I can't take all the credit, I guess. So I helped the patient get pregnant. I mean, okay, to be more accurate, I helped her body get ready to be pregnant. Let me explain. So some women struggle with fertility. And this particular patient had been to multiple doctors and tried multiple different things, and they weren't working. She wasn't getting good results. And they couldn't really tell her why, which I could only imagine must be so frustrating as a woman trying so hard to have a baby. And then she found us. And, we were able to help her. And I'll tell you sort of a little bit how. If I ask you, in terms of your body, what does your brain control? What do you think? What does it control? If you said everything, bingo, exactly every single part of your body, your immune system, your digestive system, your muscles, and your reproductive system. The nerves in your body control everything about your entire body, including the reproductive system. So imagine hypothetically, if we cut the nerves to the ovary and fallopian tubes. We would never, ever do this, obviously. But if we cut the nerves to the ovaries and fallopian tubes, how well would you think they worked? How well would they work? If you said not at all or pretty bad, absolutely right. Yeah, they wouldn't work because those nerves control that. And so when that egg comes out, first the ovary has to be signaled and actually let the egg come out. And then there's little fingers, if you will, that actually pull that egg in to the fallopian tube and begin its journey down to the uterus. And in some women, the nerves that come from your spine that go to those little fingers that control them, they're getting disrupted or they're getting disturbed. This is one example of what can cause infertility. And so if that happens, the egg comes out, but it never gets pulled into the fallopian tube and it never makes it down to the uterus. And I can't tell you 100%, but with this one, we believe that that's what was going on. And now we didn't have the scan technology back then, but now we have the scan technology where we can actually zoom in on the function of the nervous system, of the nerves that control the organs, and see exactly where the problems are coming from. And so in her case, with a few months of chiropractic adjustments, it was about 2 or 3 months, she was all of a sudden pregnant. And she continued throughout the pregnancy because we wanted to make sure that everything was functioning at its best and her body was doing as good as possible. And 9 months later, she delivered a healthy baby boy. And so that's a story on how I got a patient pregnant, sort of. So anyways, if you have anybody you know who's struggling right now, please share this with them, forward it, like it, pass it on. You never know, but the bottom line is it can only help. And the best thing to do is just get checked so you know. I hope you guys have a great day and go Vivo.